Welcome, ladies and gentlemen, for being here. We're having something like a home game here today, and I'm happy and honored to share with you our idea of how we can break the walls of personalized peptide medicine. To speak in other words, I want to show you how our purification technology helps to create new perspectives for widespread diseases like cancer. I want to start with the most obvious. What are peptides? Why are they so valuable for the pharmaceutical industry? And also, what is one of the major problems in peptide manufacturing? That was wrong. Oops. Now, peptides are biological molecules that consist of chains of amino acids. This is why we could also call them small proteins. Now, what unites all of us is that peptides are present in every cell and tissue of all our bodies. They fulfill important functions, for example, as hormones, neuropeptides, antibiotics, or toxins. From a pharmaceutical point of view, they combine the structural variability of small molecules with the high efficacy of proteins. Today, most of the pharmaceutical peptides are produced via chemical synthesis. The problem in the chemical synthesis is that in the purification process, not only the desired peptide is generated, but also unwanted sequences that have to be deleted in a subsequent step. And this purification step is one of the major obstacles for a faster dissemination of peptides. The technology that you see here is the state of the art right now, and it doesn't enable to purify peptides in parallel, but one after the other, while there's a need for a skilled conductor. This makes the technology very time-consuming, expensive, and also ecologically harmful due to the high consumption of organic solvents. My colleagues have experienced these limitations in their own research, and this is more or less the starting point for our technology, because we replace this complex machine by something as easy as this. It's a small cartridge, and we are not only able to use one of them, we are also able to use two or even more. This makes our technology the first parallel purification technology for chemically synthesized peptides in the world. With our technology, you can achieve up to 80% of time savings when you purify 8 peptides in parallel. The technology is broadly applicable and can be easily scaled up and is therefore very time and cost efficient. If you think that we want to use our technology in the whole pharmaceutical market, I want to give you an example what this potential means. Let's come back to the example of cancer treatment from the beginning. Today, off-the-shelf drugs are given to eligible patients with varying results. While some people profit from the treatment, others don't, while even others are harmed by the treatment. Now, today, we know that cancer differs from one person to the other, and this is actually what personalized immunotherapies take into account. They advance the process by a diagnostic part that helps to identify all the mutated cancer cells. And these cancer cells present so-called neoantigens on their surface. These are small peptides that are determining, so to say, the character of your tumor. And by just using the personalized approach, we copy these specific small molecules, these peptides, we give them to the patient, and therefore the immune system learns how to attack and kill cancer cells and to heal the patient. The problem in this process is still the manufacturing of the peptide. Imagine that today it is very costly to produce this set of peptides in an efficient amount of time. It takes you up to 3 to 4 months at least to get your own set of peptides. With our technology, with the parallelism and the efficiency of it, we are able to serve the peptides you want in less than 1 month. This can help people that are affected by cancer in probably late stage to get healing for their cancer. Thank you very much for your attention.